Hello, this is the post-dental report. I thought this might be quite fun to do a video while I'm still on the lidocaine and tell you a little bit about the experience of what it was all like to have a tooth extracted and also have a temporary crown put in for the molar I told you about that needs the root canal. So it's an interesting one. With Julia and I were just talking about this. She came with me, she would have come with me anyway, but we had assumed she had an appointment today. It wasn't actually on the 13th of December, it was the 13th of March. So she basically came 3 months early, but that's cool. So we just arrived early, which is nice. And so the dental treatment in Europe, or from what I remember, versus dental treatment here in the US is very different. So we both agreed on this, that like back in the day, the dentist would just give you, the lidocaine, so just take the syringe and put it into your gums and just go, in 2 or 3 places, and then you're numb, and then, like a tooth extraction would just be, and then, that's that done. But here it's very different. So here you get the anesthetic before the actual anesthetic. So there's a little bit of a numbing agent that they apply onto the gums that they're eventually going to stick the needle in, and that is just to absolutely minimize pain, which is just awesome, I gotta say. It's just very different. Julia and I were brought up like hardcore. Bleeding, what bleeding? Like I don't recall having been stitched up quite that much. So I think she must have done 8 or 10 stitches, and there was just one tooth that got extracted. But the result, she said to me, it was like she put the whole packet of medical suture in, which are what are they called? The soluble ones, the self-dissolving type stuff. And she said she's very generous with that, but she wants to absolutely minimize any bleeding. Whereas Julia, when she had her wisdom teeth out, she didn't get any stitches. And of course, as a result, she started bleeding, and that was back in the UK. It's kind of like, whoa, what's going on? I don't want to bleed to death. Oh, come on, dental treatment does that, says the dentist. Just get on with it. Kind of crazy, isn't it? So anyway, here's what we did then. So she took, her assistant rather, she took mold of my molar on the bottom right that was going to be, that now has a temporary crown on it, and that's the tooth that needs root canal. So she essentially made the work for the next specialist kind of dentist a little bit easier, because he can now go and go straight in and do the nerve thing, and the tooth is already sanded down and there's a temporary cap on there now. So that happened first. So anesthesia first, then this, then the extraction. And because it was one of those strong teeth, she didn't just pull it out in whole, she split it down in half, and that was kind of an interesting experience. I mostly didn't feel a thing. There was a little bit of pain when it came to the nerve, so I could feel that a little bit, but it wasn't so bad. So it's not something that it's almost not worth mentioning, but it wasn't completely pain-free. And so she split the tooth in half, and then she essentially kind of twisted the loose bits until they came loose enough that she could just pull them out. So there was a bit of work involved, but it was also a fairly interesting and gentle approach. And I said, can I please keep the tooth? And sadly they wouldn't let me keep it for hygienic reasons, but I was allowed to look at it once it was out. And man, the thing was decayed. To bring up a previous topic, decay was the word. So it's not so much the side, I don't actually know which side it was, the inside or the outside that I could brush, or the inside that was close to the molar that now needs the root canal. It's one of those things. I mean, since there was no enamel there, I don't know which side it was, but it was like black. It was literally brown and black, and it was just rotting away. And hey, now I know why I was in such agony, and also now I know why I couldn't quite localize it. So was it from this side? Was it from that side? We don't know, but it made perfect sense to take the tooth out, because there's really nothing that I could see was fixable, especially because the cavity continued underneath the gum line. So it was one of those things that thing was broken, man. Excellent. Anesthesia is wearing off a little bit, but this is all completely numb here. Very cool. Not allowed to suck anything out of straws like this. Mustn't do that. Can't do that. It's bad, because that's not good. And I'm on my way to the pharmacy now, because I'm being prescribed some antibiotics, so that staves off the infections. and also I think a special kind of mixture that is, I think, 3 times the normal dose of ibuprofen. So it's like a 600 milligram super strong ibuprofen if and when I need it. So I've had one at 9, that was like my regular 200 milligrams, but I think she's given me like a 600 milligram thing. Interesting stuff. So that is also nice. So, like, you know, put pain management into early on into the thought of the patient. So I was already prepared with my own Nurofen. This is something I've learned from my other dentist, Dr. Oliver. You know, take some before treatment even begins. Then we have the normal anesthesia, and now you just keep on topping that up essentially, and you get the pain under control. This is very nice. I mean, I've had previous bits and pieces done in Germany, and you know, minor surgeries, and you go home, and that's in Germany, you go home without the mere mention of pain medication, like, should it get worse, then please come back. But there's no, well, we'll give you this and then you'll be all right. No, it's just like, you gotta be tough as boots. And maybe things have changed. I mean, this is now 30 years ago since I've had that done, but it's also bizarre, isn't it, how either times change or how different things happen differently in different countries. So kind of interesting. Anyway, I'll let you know how it goes. I'm back at the dentist in 1 week for a follow-up appointment, just to see what's what and to see if things are healed. So it's just a, you know, just a follow-up thing, and I'm sure I will speak to you on that occasion, because, you know, I like bringing the bike videos back, and it's whenever I get the chance, I like putting the camera on and, you know, just having a chat. Anyway, have a wonderful week until then, and I will see you next week. Bye bye.